Have you ever walked into a room and forgotten why you were there? You pause, you look around, and for a moment it's like your mind drew a blank. Now imagine that blankness spreading, not just for a moment, but for hours, days, and eventually years. Every 66 seconds, another senior in America is diagnosed with dementia. But here's the truth most people don't know. For many, it wasn't inevitable. The culprit isn't always age. Often, it's the medications quietly sitting in your medicine cabinet. Pills for sleep, pills for allergies, pills for bladder control. Medications that seem helpful, but may be silently harming the part of your brain responsible for memory. You might think, my doctor prescribed these, so they must be safe. That's natural. But did you know most doctors receive less than 8 hours of training on how drugs affect aging brains? It's not negligence. They simply don't know the full picture. The pharmaceutical industry has spent decades normalizing these prescriptions. Meanwhile, much of the research about cognitive risks remains hidden. Today, you have the chance to change that. You can learn which medications are risky, what safer alternatives exist, and how to protect your memory before it's too late, because every pill is a choice, and every choice matters. Think of your brain as a library. Every memory, every conversation, every experience, neatly stored on shelves. Now imagine someone sneaks in each night and quietly removes a few books. At first, it's barely noticeable, but over time, entire sections vanish. This is what anticholinergic medications do. They block acetylcholine, a neurotransmitter essential for forming new memories. And as we age, our natural acetylcholine levels already decline. Adding these medications is like dimming an already fading light. The risk is real. A 2025 study in Alzheimer's research and therapy showed that seniors with a high anticholinergic burden had up to 227% higher odds of developing dementia. Another 2024 German study reported that seniors using multiple anticholinergic drugs for over 4 years had more than double the risk of memory loss. It's not just one pill at a time. The danger comes from the cumulative effect known as anticholinergic burden. Each medication adds weight. Together, they can overwhelm the brain's ability to maintain memory and focus. The anticholinergic cognitive burden scale, or ACB, can help. It scores medications from 1 to 3 based on their impact on memory. A total score of 3 or higher indicates significant risk. You can check your medications online or with your pharmacist. Even drugs that seem harmless on their own, like sleep aids, allergy pills, or bladder medications, can combine into a dangerous cocktail over time. Instead of feeling safe, your brain is quietly under siege. Understanding this burden is the first step. Before we dive into the 7 medications that are most dangerous for seniors, know this. Your brain's health depends on every choice you make. And when it comes to medications, some choices can cost more than you realize. You reach for it when allergies strike, or to finally get a good night's sleep. Benadryl, Tylenol PM, Advil PM, anything with PM in the name. It seems harmless, right? A little pill to help you rest. But here's the reality. Diphenhydramine, the active ingredient, is a dirty drug. It blocks not just histamine, but also acetylcholine, the neurotransmitter your brain uses to form new memories. Think of acetylcholine as the librarian in your brain. Without it, nothing gets filed. Conversations fade, faces blur, keys vanish from memory. The adult changes in thought study followed over 3,500 seniors for 7 years. The findings were striking. Regular use of diphenhydramine increased dementia risk by 54%. As we age, natural acetylcholine production drops. Adding a drug that blocks what little remains is like turning off the lights in a dark room. That morning, fuzziness is not just grogginess. It's your hippocampus struggling to function. So what can you do instead? For allergies, switch to loratadine or cetirizine. For sleep, try melatonin, magnesium glycinate, or chamomile tea. These alternatives work with your brain's natural chemistry instead of against it. Even occasional use isn't risk-free. Each dose contributes to the anticholinergic burden. Over time, small amounts accumulate until the damage becomes significant. Before you take that PM pill tonight, ask yourself this: is a single night of sleep worth a lifetime of memory loss? You're in pain. Maybe it's arthritis, back pain, or lingering post-surgical aches. Your doctor wants to help, so they prescribe something powerful: oxycodone, hydrocodone, morphine, or fentanyl. At first it works. The pain eases. You sleep better. But there's a hidden cost. Opioids flood your brain with artificial pleasure signals. They calm nerves, but they also slow down the central nervous system, and that includes the neurons responsible for memory, attention, and decision-making. A 2023 study at UC San Francisco scanned seniors using opioids for chronic pain. White matter, the brain's communication highways, showed significant deterioration, and gray matter volume shrank up to 3% per year. That's triple the normal aging rate. Another study of over 13,000 seniors found that long-term opioid use increased dementia risk by 1.4 times, and with higher doses, the risk jumped to 2.1 times. Here's the cruel cycle. Chronic pain itself clouds thinking, and the medication that's supposed to help makes it worse. One patient said, "I traded my back pain for my brain and didn't even realize it." So what can you do? Start with non-opioid alternatives. Acetaminophen doesn't cross the blood-brain barrier. Topical NSAIDs like diclofenac gel target pain locally. Physical therapy strengthens muscles and improves cognitive function. And cognitive behavioral therapy for pain can reduce the perception of pain by 30 to 50% without medications. If you're already on opioids, never stop suddenly. Work with your doctor to taper slowly while incorporating safer methods. Because relief from pain should not come at the cost of losing your mind. Small accidents, a late-night rush to the bathroom, embarrassment, loss of dignity. To help, doctors often prescribe pills like oxybutynin, toltrodine, or sulfenacin. Fewer accidents, more confidence. But there's a hidden cost. These medications block acetylcholine, calming the bladder muscles, but they also cross into the brain. Once inside, they interfere with memory, word recall, and mental clarity. A 2019 study in the British Medical Journal found that just 1 year of oxybutynin use increased dementia risk by 130%. Dr. Shelley Gray's research tracked over 3,400 seniors and found measurable cognitive decline within 60 days of starting anticholinergic bladder medications. One participant said, "I stopped wetting myself, but I started forgetting myself." The good news? Safer alternatives exist. Mirabegron relaxes the bladder without affecting acetylcholine. Botox injections last 6 to 9 months, and pelvic floor therapy strengthens muscles naturally. Lifestyle changes, like scheduled bathroom visits, avoiding fluids late at night, and reducing caffeine or alcohol, can help in 60% of cases. Regaining bladder control shouldn't mean losing your memories. Dignity is both physical and mental. You might not be depressed. Maybe you're taking a pill for nerve pain, migraines, or even sleep. Amitriptyline, nortriptyline, doxepin. These are tricyclic antidepressants, old, cheap, widely prescribed. But they are also among the most harmful drugs for aging brains. They block acetylcholine across the system. Unlike Benadryl, which nudges acetylcholine aside, tricyclics carpet bomb your memory networks. They also disrupt the brain's nightly cleaning process, the process that flushes toxic proteins like beta amyloid, key players in Alzheimer's disease. A decade-long study in JAMA Internal Medicine found that seniors on tricyclics daily had a 54% higher risk of dementia. Even low doses for sleep increase the risk by 31%. Cognitive impairment can start within 2 weeks, with word-finding difficulties, forgotten appointments, and mental fog. Safer alternatives exist. SSRIs like sertraline, SNRIs like duloxetine, gabapentin for nerve pain, and trazodone for sleep. These preserve acetylcholine and protect memory. If you take a tricyclic, don't panic. Work with your doctor to taper safely. Many patients feel mentally sharper within weeks after switching, because every day on the wrong medication is another day your brain fights uphill just to remember who you are. You can't sleep another night staring at the ceiling, so you reach for a prescription, Ambien, Lunesta, Sonata. Your doctor said it's safe, but here's the truth. Z drugs don't give real sleep. They give unconsciousness while interfering with your brain's cleanup process. During deep sleep, brain cells shrink up to 60%. This allows cerebrospinal fluid to flush out toxic proteins like beta amyloid. It's your brain's natural dishwasher, but Z drugs suppress the specific brain waves that trigger this cleaning. A 2024 Taiwanese study of over 260,000 seniors found that regular zolpidem users were 2.3 times more likely to develop Alzheimer's in 5 years. Even occasional use, just 2 to 3 times a week, increased risk by 70%. Why? Z drugs artificially boost GABA, the brain's brake pedal. Neurons become dependent. When the drug wears off, the brain rebounds with excessive activity, the hippocampus suffers, memory declines, and the cycle worsens insomnia. Alternatives work better while protecting the brain. Cognitive behavioral therapy for insomnia, sleep restriction therapy, magnesium threonate, and basic sleep hygiene all restore natural deep sleep. One patient said, "I thought Ambien helped me sleep. Turns out it was helping me forget." 6 months after stopping, clarity returned. Before reaching for that sleeping pill again, ask yourself this: would you rather rest for one night or protect your memories for a lifetime? You're anxious, tense. Your doctor prescribes Xanax, Ativan, Valium, or Klonopin to calm you. At first it works. Thoughts slow. Fear fades. But over time, so does your clarity, your memory, and even your sense of self. Benzodiazepines boost GABA, the brain's natural brake. Chronic use depresses neurons, slows reaction times, and dulls cognition. The brain adapts, becoming dependent. Receptors lose sensitivity, and withdrawal is dangerous. Seizures, hallucinations, severe confusion. A BMJ study of 8,000 seniors found that just 3 months of benzodiazepines increased Alzheimer's risk by 51%. For long-acting drugs, the risk jumped to 70%. Gray matter shrinks. The hippocampus can lose up to 10% of its volume. Prefrontal cortex activity drops, affecting decision-making and personality. But there is hope. The Ashton Manual provides safe tapering schedules. Alternatives like buspirone relieve anxiety without harming memory. And mindfulness meditation can even increase hippocampal volume, rebuilding what benzodiazepines damage. One patient said, "I stopped feeling anxious, but I also stopped feeling anything. Now, after tapering, I remember my grandkids' birthdays again." Anxiety is real, but your brain's health is more important. Calm should never cost your mind. Antipsychotics like Seroquel, Risperdal, Zyprexa, and Haldol were designed for severe mental illnesses. Yet today, they're often prescribed to seniors for insomnia, anxiety, or behavioral issues, sometimes simply for convenience in nursing homes. 1 in 5 residents receives them, not because of medical necessity, but because they are easier to manage. These drugs block dopamine, a key neurotransmitter for movement, motivation, and cognition. In seniors, this can lead to rapid cognitive decline, dull personality, and loss of independence. A 2025 Lancet study found that antipsychotics cause 71% faster cognitive decline in just 6 months. Brain volume decreased 1.2% per year, double the normal aging rate. Stroke risk increases by 70%, and death risk rises by 60% in dementia patients. But safer, non-drug interventions work. Validation therapy, familiar routines, music, pet therapy. All of these can reduce agitation without harming the brain. Families report improvement and recognition returning after tapering antipsychotics. These drugs may control behavior, but they steal identity and memory. Always ask, is this medication necessary? Can alternatives protect the brain? Because life isn't just about being alive. It's about being present, being aware, and being remembered. Even if you don't take every high-risk medication, the total load matters. This is called anticholinergic burden. Each drug that blocks acetylcholine, sleep aids, allergy pills, bladder medications, adds to your brain's stress. Alone, they may seem harmless. Together, they form a toxic cocktail. The Anticholinergic Cognitive Burden, or ACB scale, measures risk. Scores range from 1 to 3 per drug. A total score of 3 or more signals serious danger. Studies show seniors taking 3 or more anticholinergic medications have up to 2.6 times higher dementia risk. Most doctors do not calculate this cumulative risk. They treat conditions separately, one pill for sleep, another for bladder, another for pain. Individually safe? Perhaps. Collectively, your memory suffers. One patient, taking 5 medications prescribed by different doctors, discovered the truth after reviewing her ACB score with a pharmacist. She replaced risky drugs with safer alternatives, and within months, memory and clarity returned. The lesson is clear. Don't wait for a crisis to add up your total burden. Make a list, check scores, consult professionals, and take action. Your brain's health depends on it. After everything, here's the good news. It is not too late. Your brain can heal. This is called neuroplasticity, the brain's ability to rewire, adapt, and even regenerate. And it doesn't stop at 60, 70, or even 80. A 2025 study in Alzheimer's Research and Therapy followed seniors who reduced their anticholinergic burden over a year. Results showed measurable improvement in memory and focus. Patients who carefully tapered medications regained cognitive function, proving the brain can recover. One 78-year-old woman had been on 5 high-risk medications. Her family was planning for memory care. She made a list, consulted her doctor, and tapered safely. 2 years later, she said, "I'm sharper now than I was at 65. I got my life back." Neuroplasticity works not just by removing harmful drugs. Supporting your brain with healthy sleep, exercise, cognitive challenges, meditation, and social engagement strengthens recovery. Even small steps, tracking symptoms, practicing mindfulness, adjusting routines, help your brain rebuild its networks. The key takeaway is this: damage from medications is often reversible, and the human brain wants to heal. With knowledge, action, and patience, you can reclaim clarity, memory, and independence. Now that you know the truth, it's time to act. Step 1. Make a complete list of every medication and supplement you take. Prescription, over-the-counter, even occasional pills. Step 2. Check their anticholinergic cognitive burden scores online or with a pharmacist. Add them up. A total score of 3 or more is a serious warning. Step 3. Bring this list to your doctor. Ask, are there safer alternatives? Don't stop medication suddenly. Taper safely under medical supervision. If your concerns are dismissed, seek a second opinion or consult a geriatric pharmacist. Step 4. Track your memory, focus, and mental clarity in a symptom journal. This helps monitor progress and supports discussions with healthcare professionals. Share this video with friends and family over 60. Encourage them to review their medications. Drop a comment below with your list. We're providing personalized guidance. Subscribe and hit the bell because next week we reveal supplements that actually protect your brain from pharmaceutical damage. Remember this, every pill is a choice. Every choice affects your brain. You've earned the right to age with clarity, dignity, and memory intact. Will you take action before it's too late?